morning, nurses. So I'm listening to a book called Zero Harm, and it's like a famous book that talks about hospital care and how to prevent harm in patients, how the whole process came about of patient experience, all of the important things that we need to know to improve care, and they don't call it patient satisfaction anymore, but improve the patient experience. So I'm thinking it all usually comes down to hourly rounding, which I 100% agree with. If you're in that room every hour, the patient's going to be safer, more knowledgeable, get better care, etc. But somehow hospitals across the nation can't get in that room every hour consistently, right? And it always comes down to we have to penalize the nurses if they're not in there, or it's the fault of the staff because they weren't in the room enough so the patient fell. Those all may be true statements, but as a bedside nurse, I'm thinking about, couldn't we do a quantitative collection study where, there's a finite number of hours in the day, right? The nurse is there for 12 hours, so he or she has to get in the room at least 12 times. And we could add up or approximate the number of tasks that must be accomplished every hour. So we have to include things like assessment, vital signs, medication, charting, teaching, hygiene, keeping the room tidy, writing on the whiteboard, calling the doctor, all of those things, right? And I'm willing to bet, if you added up all those tasks and you took that 12 hours and divided up by the number of tasks, I don't think the math would come out right. I don't think that there's enough hours in the day to be in the room every hour. And of course then they say, well, you have a CNA. Yes, but my CNA has to do vitals every 4 if we're on a tele floor. They have to do all the hygiene. They have to often do the I&O collection, empty the Foleys, clean out the hat in the toilet, empty the PureWick canister, all of those things. And if they have 14 patients and I have 4 or 5, I don't think that CNA can adequately offset the amount of times I have to be in the room, or supplement the amount of times I have to be in the room. And then there's also the factor of, if I don't have a unit secretary, well, now I have more work because I have to deal with orders and more phone calls and admitting the patient, doing all the paperwork, discharging the patient, all those things. Hopefully I have a charge nurse to assist with that, but if the floor has 30, 40 patients, they're doing that with multiple patients. So I just think that as a leader in a hospital, we need to be thinking about and getting more creative with, how do we get in that room every hour? And I'm not sure what the answer is or what that looks like. I'm certainly thinking about it often, because if I was the patient or family, of course I would want that kind of care. But I just don't know that it is physically and mentally and emotionally possible for one nurse to be in the room that often. Let me know what you think in the comments, and I'll chat with you later.